welcome to the deep dive. Today, we're diving into something really practical. First aid for burns.
Yeah, absolutely essential stuff.
We've basically pulled the absolute must-knows from the proper first aid manuals, for adults and kids. The idea is a quick guide, something to boost your confidence.
Exactly, like a bite-sized study aid. Perfect if you're maybe refreshing your skills or for families, small workplaces, just the core actions.
We want you to feel, reassured and ready, not nervous.
Confident action, that's the goal.
Okay, so let's unpack this a bit. Someone gets a burn, or maybe a scald from hot water.
Yeah.
First thing is, what are we actually looking at?
Right. The sources talk about different types, basically how deep the burn goes. You've got superficial.
Oh, like a sunburn, maybe? Just red skin?
Yeah, exactly. Then partial thickness, which is often red, definitely blistered, and usually really painful. Ouch.
Very painful. Okay. And the last one?
Full thickness. That's the deepest. It might look kind of white or waxy, maybe even charred. And here's the strange thing. It might actually hurt less. The nerve endings can be destroyed, so the pain signals just don't get through as much.
Wow, okay. That's surprising. But no matter the type, or if it's a child or an adult, the immediate first step is the same.
Absolutely critical, yes. You have to stop the burning process. Safely, of course.
Meaning get them away from the heat source, or the chemical, or electricity.
Exactly. If it's heat, move them. Chemical, flush with loads of water. Electrical. You must make sure the power's off before you even think about touching them. Your safety first.
Right. Good point. And the manuals mention gloves.
Yeah. Disposable gloves if you have them. Always a good idea.
Okay, so burning stopped, scene is safe. What's the absolute number one thing you do right then?
Cool the burn. Simple as that. The sources are really clear on this.
Just cool water.
Cool or lukewarm running water. And not just a quick splash for at least 20 minutes. Minimum.
20 minutes, okay. No ice, no butter, none of that old stuff.
Definitely not. Just cool running water. It stops the heat continuing to damage the tissue underneath. It's vital.
And while you're doing that cooling, what else? There was something about clothes and jewelry.
Good point. Yeah, while you're cooling, gently try to remove any clothing or jewelry that's near the burn. But, and this is really important,
What's that?
if anything is stuck to the skin, leave it alone. Don't try and peel it off.
Okay, don't pull stuck stuff. Got it. And blisters. I remember something about blisters.
Right. Do not burst them. They're like a natural, sterile dressing protecting the damaged skin underneath. Leave them intact.
All right. So, stop the burn, cool for 20 minutes, minimum. Gently remove loose things, leave stuck things, don't pop blisters. Makes sense. What about after the cooling?
After you've done the cooling, you need to cover the burn.
With what? A bandage?
Ideally, a loose, sterile dressing. That's the standard advice.
But what if you're, at home or somewhere and don't have one?
Okay, yeah. This is where cling film comes in. The sources actually mention it specifically, especially for kids' burns.
Cling film. Really? Like from the kitchen?
Yep.
You layer it loosely over the burn. Apparently it's good because it doesn't tend to stick. It's clean if you discard the first few inches from the roll.
Oh, okay, that makes sense.
It protects the burn from infection, and you can still see the injury through it. Just make sure if you're still needing to cool, you can continue cooling over the cling film.
Interesting. Okay, cling film is a backup. Good tip. So we've stopped it, cooled it, covered it.
Yeah.
But when is it serious enough that you need to call for an ambulance or get to a hospital right away?
Knowing when to escalate is crucial. Definitely get medical help immediately for any full-thickness burn.
Right, the deep ones.
Any burn that affects their airway or breathing. So burns to the face, or if they've maybe inhaled smoke or hot air.
Okay, airway serious. What else?
Electrical burns and chemical burns always need checking out properly by professionals. And then size matters too.
How big is too big for home care?
Well, the guides suggest using the person's hand palm and fingers as roughly 1% of their body area. So if a superficial burn covers more than about 5%.
So like 5 of their hand sizes. Roughly, yes. Or if a partial thickness burn is large, the figure often used for adults is over 9%. You need help. For children, though, the advice is generally more cautious.
Seek help sooner for kids.
Yeah, basically for any burn that's more than very minor, or again, if it's superficial but over 5%, or involves the airway or breathing, better safe than sorry with kids.
Makes total sense. And through all this, there's the person themselves. They might be scared, especially kids.
Absolutely. Reassuring them, keeping them calm, that's a massive part of first aid too. Don't underestimate that.
So the bite-sized takeaway really is cool burns with water for at least 20 minutes. cover them appropriately, and know the warning signs for when to get immediate medical help.
That's the core of it, yes. Simple steps, huge difference. And remember, this was just the quick guide. We do have a deep guide available if you want to really get into the details.
Fantastic. Thinking about these simple, critical steps for burns, it really makes you think, doesn't it? What other common emergencies are out there where just knowing that one key immediate action could make all the difference? Something to ponder.